Question 1. A nurse is caring for a client with a new prescription for continuous intravenous infusion of heparin. Which nursing interventions are appropriate for this client? Select all that apply. A. Monitor activated partial thromboplastin time, APTT, levels regularly. B. Administer intramuscular injections only as needed for pain. C. Assess for signs of bleeding, such as petechiae or hematuria. D. Maintain consistent administration rate using an infusion pump. E. Encourage the client to ambulate frequently to prevent stasis. F. Avoid aspirin and NSAIDs due to increased bleeding risk. Answer. Monitor activated partial thromboplastin time, APTT, levels regularly, assess for signs of bleeding, such as petechiae or hematuria, maintain consistent administration rate using an infusion pump, avoid aspirin and NSAIDs due to increased bleeding risk. This question tests the nurse's understanding of safe heparin administration and monitoring. Key clues are continuous intravenous infusion of heparin and the need for appropriate nursing interventions. Monitoring APTT ensures the medication is within therapeutic range, assessing for bleeding is crucial due to heparin's anticoagulant effects, and using an infusion pump maintains a steady, safe dose. Additionally, avoiding other medications that increase bleeding risk, like aspirin and NSAIDs, is vital. For instance, if a client on heparin develops bloody urine, the nurse must immediately recognize this as a sign of excessive anticoagulation. Always prioritize safety when administering anticoagulants by consistently monitoring for therapeutic effects and adverse reactions. Question 2. The nurse is educating a client recently diagnosed with heart failure about dietary modifications. Which statements indicate the client understands the teaching? Select all that apply. A. I should try to eat foods low in sodium, like fresh fruits and vegetables. B. I can still enjoy my favorite processed foods in moderation. C. I need to limit my daily fluid intake as instructed. D. I should weigh myself every morning and report any sudden changes. E. It's important to increase my intake of high-fat dairy products. F. I will choose lean protein sources such as grilled chicken or fish. Answer. I should try to eat foods low in sodium, like fresh fruits and vegetables. I need to limit my daily fluid intake as instructed. I should weigh myself every morning and report any sudden changes. I will choose lean protein sources such as grilled chicken or fish. This question assesses the client's comprehension of essential dietary and self-monitoring strategies for managing heart failure. The phrase "client understands the teaching" indicates correct statements should be selected. Clients with heart failure benefit from a low-sodium diet, restricted fluid intake to prevent fluid overload, and daily weight monitoring for early detection of fluid retention. Choosing lean protein sources is also important for overall health and managing heart failure. For example, opting for baked fish instead of fried chicken is a good dietary choice for this condition. Remember that managing heart failure involves diligent self-care, particularly regarding diet and monitoring fluid status. Question 3. A client is admitted with suspected appendicitis. Which assessment findings should the nurse expect? Select all that apply. A. Rebound tenderness at McBurney's point. B. Right lower quadrant, RLQ, pain that worsens with movement. C. Abdominal distension and generalized abdominal pain. D. A palpable mass in the epigastric region. E. Nausea and vomiting. F. Low-grade fever. Answer. Rebound tenderness at McBurney's point, right lower quadrant, RLQ, pain that worsens with movement, nausea and vomiting, low-grade fever. This question tests the nurse's knowledge of classic signs and symptoms of appendicitis. Suspected appendicitis is the key phrase, guiding the selection of common findings. Rebound tenderness at McBurney's point, localized RLQ pain exacerbated by movement, nausea, vomiting, and a low-grade fever are all characteristic indicators. Generalized abdominal pain or a palpable mass in the epigastric region are less specific to appendicitis and may indicate other conditions. A practical example is a client reporting sharp pain when the nurse quickly removes pressure from their right lower abdomen. Always prioritize assessing for these specific signs when appendicitis is suspected. Question 4. A nurse is providing discharge teaching for a client with a new colostomy. Which instructions should the nurse include? Select all that apply. A. Empty the ostomy bag when it is 1/3 to 1/2 full. B. Change the ostomy appliance daily to prevent skin irritation. C. Report any significant changes in stoma color or swelling. D. Avoid foods that cause gas or odor, such as cabbage and beans. E. Cleanse the skin around the stoma with mild soap and water. If it's normal to have blood in the stool for several weeks post-surgery. Answer. Empty the ostomy bag when it is 1/3 to 1/2 full. Report any significant changes in stoma color or swelling. Avoid foods that cause gas or odor, such as cabbage and beans. Cleanse the skin around the stoma with mild soap and water. This question focuses on essential discharge teaching for a client managing a new colostomy. The key concept is self-care after surgery, with new colostomy and discharge teaching as important clues. Emptying the pouch when 1/3 to 1/2 full prevents leakage and keeps it light. Reporting stoma changes ensures early detection of complications, and avoiding gas-producing foods helps manage symptoms. Cleansing the skin gently with mild soap and water promotes skin integrity. For example, a client should be taught to recognize a healthy, pinkish-red stoma versus a pale or dusky one. Remember, proper ostomy care empowers clients to manage their condition effectively and prevent complications. Question 5. The nurse is preparing to administer medications through a nasogastric (NG) tube. Which actions should the nurse take? Select all that apply. A. Crush all enteric-coated tablets to ensure proper absorption. B. Verify tube placement before administering medications. C. Flush the tube with 15 to 30 milliliters of water before and after medication administration. D. Mix all medications together in a single syringe to save time. E. Administer medications slowly, allowing gravity to assist. F. Keep the head of the bed elevated at 30 to 45 degrees during and for 30 to 60 minutes after administration. Answer. Verify tube placement before administering medications. Flush the tube with 15 to 30 milliliters of water before and after medication administration. Administer medications slowly, allowing gravity to assist. Keep the head of the bed elevated at 30 to 45 degrees during and for 30 to 60 minutes after administration. This question assesses the nurse's knowledge of safe medication administration via an NG tube. The key phrase, administer medications through a nasogastric (NG) tube, highlights the need for careful technique. Verifying tube placement prevents aspiration, flushing before and after prevents clogging and ensures delivery, and administering slowly with gravity aids absorption. Keeping the head of the bed elevated reduces the risk of aspiration. For example, before giving medication, the nurse might aspirate gastric contents and check the pH to confirm tube placement. Always prioritize client safety by meticulously following procedural guidelines for NG tube medication administration. Question 6. A client in the emergency department presents with symptoms of an acute myocardial infarction, MI. Which interventions should the nurse anticipate implementing? Select all that apply. A. Administer oxygen therapy. B. Obtain a 12-lead electrocardiogram, ECG. C. Administer intravenous, 4, fluids rapidly. D. Administer nitroglycerin sublingually. E. Prepare for immediate surgical intervention. If. Initiate continuous cardiac monitoring. Answer. Administer oxygen therapy, obtain a 12-lead electrocardiogram, ECG, administer nitroglycerin sublingually, initiate continuous cardiac monitoring. This question focuses on the immediate nursing interventions for a client experiencing an acute myocardial infarction. The keywords acute myocardial infarction signal the need for rapid, critical actions to preserve cardiac muscle. Administering oxygen improves myocardial oxygenation. A 12-lead ECG is crucial for diagnosis. Nitroglycerin helps dilate coronary arteries and reduce pain, and continuous cardiac monitoring allows for early detection of arrhythmias. For example, if a client reports chest pain, the nurse immediately ensures they are receiving oxygen and prepares for an ECG. Remember the acronym MONA, morphine, oxygen, nitroglycerin, aspirin, as a helpful reminder for initial MI management, though aspirin is often given by EMS or physician order. Question 7. The nurse is caring for a client experiencing a grand mal seizure. Which actions are appropriate during the seizure? Select all that apply. A. Restrain the client's limbs to prevent injury. B. Protect the client's head with a pillow or blanket. C. Turn the client to their side. D. Insert a tongue blade to prevent the client from biting their tongue. E. Loosen tight clothing around the client's neck. F. Document the time and characteristics of the seizure. Answer. Protect the client's head with a pillow or blanket, turn the client to their side, loosen tight clothing around the client's neck, document the time and characteristics of the seizure. This question tests the nurse's immediate priorities and interventions during a grand mal seizure. The phrase grand mal seizure is the primary clue, indicating a need for safety measures. Protecting the head, turning the client to their side to prevent aspiration, and loosening restrictive clothing are all vital for client safety during the event. Documenting the seizure's details helps healthcare providers understand its nature and guide treatment. For instance, the nurse should immediately cushion the client's head on the floor while gently rolling them to their side. Always prioritize client safety and airway management during a seizure. Question 8. A nurse is providing care for a client receiving total parenteral nutrition, TPN. Which actions should the nurse include in the plan of care? Select all that apply. A. Monitor blood glucose levels frequently. B. Change the TPN tubing every 72 hours. C. Assess the client's central line insertion site for signs of infection. D. Administer TPN at a rapid rate if the client falls behind schedule. E. Obtain daily weights. F. Monitor liver function tests periodically. Answer. Monitor blood glucose levels frequently, assess the client's central line insertion site for signs of infection, obtain daily weights, monitor liver function tests periodically. This question assesses the nurse's comprehensive understanding of managing a client on total parenteral nutrition, TPN. The keyword total parenteral nutrition indicates a need for diligent monitoring due to the high glucose content and central line access. Frequent blood glucose monitoring is essential due to the high dextrose content. Assessing the central line site prevents infection. daily weights monitor fluid balance, and liver function tests detect potential complications. For example, if a client's blood glucose suddenly spikes, the nurse must intervene to prevent hyperglycemia. Always remember that TPN requires careful monitoring to ensure therapeutic effectiveness and prevent serious complications. Question 9. The nurse is caring for a client with a history of deep vein thrombosis, DVT, who is prescribed warfarin. Which client teachings are most important? Select all that apply. A. You should avoid eating green leafy vegetables. B. Report any unusual bleeding or bruising immediately. C. It is safe to take over-the-counter pain relievers like ibuprofen for headaches. D. You will need regular blood tests to monitor your INR. E. Use a soft bristle toothbrush and an electric shaver. F. You can skip a dose if you feel fine, but never take a double dose. Answer. Report any unusual bleeding or bruising immediately. You will need regular blood tests to monitor your INR. Use a soft bristle toothbrush and an electric shaver. This question tests the nurse's knowledge of essential client education for warfarin therapy. The keywords deep vein thrombosis, DVT, and warfarin highlight the need for anticoagulant teaching. Reporting unusual bleeding or bruising is crucial because it indicates excessive anticoagulation. Regular INR monitoring ensures the drug is within therapeutic range, and using a soft bristle toothbrush and electric shaver helps prevent injury and bleeding. For instance, a client should know to call their doctor if they notice persistent nosebleeds or blood in their urine. Emphasize that warfarin is a high-alert medication requiring strict adherence to monitoring and safety precautions. Question 10. A client with type 1 diabetes mellitus is experiencing signs of hypoglycemia. Which actions should the nurse take? Select all that apply. A. Administer 4 ounces of orange juice. B. Administer 1 mg glucagon intramuscularly if the client is unconscious. C. Provide a complex carbohydrate and protein snack after symptoms resolve. D. Encourage the client to exercise vigorously to raise blood sugar. E. Administer 50% dextrose for push if the client is unable to swallow. F. Recheck blood glucose levels after 15 minutes. Answer. Administer 4 ounces of orange juice. Administer 1 mg glucagon intramuscularly if the client is unconscious. Provide a complex carbohydrate and protein snack after symptoms resolve. Administer 50% dextrose for push if the client is unable to swallow. Recheck blood glucose levels after 15 minutes. This question addresses the critical interventions for managing hypoglycemia in a client with type 1 diabetes. The phrase signs of hypoglycemia indicates the need for rapid glucose administration. Administering a fast-acting carbohydrate like orange juice is appropriate for a conscious client, while glucagon or 50% dextrose is used for an unconscious client or one unable to swallow. Following up with a complex carbohydrate and protein snack prevents recurrence, and rechecking blood glucose ensures treatment effectiveness. For example, if a client feels shaky and clammy, the nurse would immediately offer orange juice or glucose tablets. Prompt recognition and treatment of hypoglycemia are vital to prevent serious neurological complications. Question 11. The nurse is assessing a client newly admitted with a diagnosis of dehydration. Which assessment findings would the nurse expect? Select all that apply. A. Bounding peripheral pulses. B. Decreased skin turgor. C. Increased urine output. D. Dry mucous membranes. E. Orthostatic hypotension. F. Bradycardia. Answer. decreased skin turgor, dry mucous membranes, orthostatic hypotension. This question tests the nurse's ability to identify classic signs of dehydration. The diagnosis of dehydration is the central clue, requiring recognition of fluid volume deficit symptoms. Decreased skin turgor, dry mucous membranes, and orthostatic hypotension, a drop in blood pressure upon standing, are all consistent indicators of dehydration due to reduced intravascular volume. Bounding pulses, increased urine output, and bradycardia are typically seen in fluid overload or other conditions. For instance, a client might report feeling dizzy when standing up quickly, a common symptom of orthostatic hypotension in dehydration. Early recognition of dehydration symptoms is crucial to initiate prompt fluid replacement and prevent complications. Question 12. A nurse is providing education to a group of pregnant clients about preventing neural tube defects. Which dietary recommendations should the nurse emphasize? Select all that apply. A. Increase intake of foods rich in calcium. B. Consume foods fortified with folic acid. C. Ensure adequate intake of vitamin D. D. Eat plenty of dark, leafy green vegetables. E. Supplement with 400 micrograms of folic acid daily. F. Limit dairy products due to potential fat content. Answer. Consume foods fortified with folic acid, eat plenty of dark, leafy green vegetables, supplement with 400 micrograms of folic acid daily. This question focuses on crucial nutritional advice for pregnant clients to prevent neural tube defects. The keywords pregnant clients and preventing neural tube defects highlight the importance of folic acid. Consuming foods fortified with folic acid, eating dark, leafy green vegetables, which are natural sources, and supplementing with 400 micrograms of folic acid daily are all essential interventions for preventing these birth defects. Calcium and vitamin D are important for overall pregnancy health, but not specifically for neural tube defect prevention. For example, recommending cereals fortified with folic acid and a daily prenatal vitamin containing folic acid are practical suggestions. Emphasize that adequate folic acid intake before and during early pregnancy is vital for healthy fetal development. Question 13. The nurse is caring for a client diagnosed with Clostridium difficile infection, CDI. Which infection control measures are appropriate? Select all that apply. A. Use an alcohol-based hand rub before and after client contact. B. Place the client in a private room. C. Wear gloves and a gown when entering the client's room. D. Use soap and water for hand hygiene. E. Clean surfaces with a standard disinfectant wipe. F. Restrict visitors to immediate family only. Answer. Place the client in a private room, wear gloves and a gown when entering the client's room, use soap and water for hand hygiene. This question tests the nurse's knowledge of appropriate infection control measures for Clostridium difficile. The key phrase, Clostridium difficile infection, CDI, indicates the need for contact precautions. Placing the client in a private room, wearing gloves and a gown upon entry, and performing hand hygiene with soap and water, as alcohol-based sanitizers are ineffective against C. difficile spores, are all critical interventions. Standard disinfectant wipes may not be sporicidal, and visitor restrictions are typically based on facility policy rather than being a primary C. difficile precaution. For instance, after providing care, the nurse must wash their hands thoroughly with soap and water for at least 20 seconds. Always remember that meticulous hand hygiene with soap and water is paramount for preventing the spread of C. difficile. Question 14. A client is experiencing a transfusion reaction. Which nursing actions are priorities? Select all that apply. A. Administer diphenhydramine as ordered. B. Stop the transfusion immediately. C. Obtain vital signs. D. Notify the healthcare provider. E. Elevate the client's feet and administer oxygen. F. Send the blood bag and tubing back to the blood bank. Answer. Stop the transfusion immediately, obtain vital signs, notify the healthcare provider, send the blood bag and tubing back to the blood bank. This question assesses the immediate priorities when a client experiences a transfusion reaction. The keywords transfusion reaction highlight the need for rapid, sequential intervention to prevent further harm. Stopping the transfusion immediately is the first critical step, followed by obtaining vital signs to assess the severity, notifying the healthcare provider for further orders, and sending the blood bag and tubing to the blood bank for analysis. Administering diphenhydramine or oxygen may be ordered by the provider but are not the absolute first steps in stopping the reaction. For example, if a client develops chills and hives, the nurse's first action is to clamp the transfusion line. Always prioritize stopping the harmful exposure and notifying the medical team for a transfusion reaction. Question 15. The nurse is reinforcing teaching for a client prescribed digoxin. Which instructions should the nurse include? Select all that apply. A. Take your pulse for a full minute before taking this medication. B. If you miss a dose, take 2 doses the next time. C. Report any yellow or green halos around lights. D. This medication helps your heart pump more effectively. E. Expect to feel increased fatigue and weakness. F. Increase your intake of high potassium foods. Answer. Take your pulse for a full minute before taking this medication. Report any yellow or green halos around lights. This medication helps your heart pump more effectively. Increase your intake of high potassium foods. This question tests the nurse's understanding of essential client education for digoxin therapy. The medication digoxin is the key, indicating the need to monitor for both therapeutic effects and toxicity. Taking the pulse before administration is crucial to detect bradycardia, reporting visual disturbances like halos alerts to toxicity, and understanding that it improves heart pumping. Positive inotropy confirms comprehension. Increasing potassium intake is important as hypokalemia can potentiate digoxin toxicity. For instance, a client should be taught to hold the medication and call their doctor if their heart rate is below 60 beats per minute. Always emphasize the importance of monitoring for both therapeutic effects and signs of toxicity with digoxin. Question 16. A nurse is preparing to administer an intramuscular (IM) injection. Which actions are appropriate? Select all that apply. A. Use a 25-gauge, 5/8" needle for an adult. B. Select the deltoid muscle for volumes greater than 3 milliliters. C. Aspirate for blood return before injecting the medication. D. Use the Z-track method to prevent medication leakage. E. Administer the injection at a 45-degree angle. F. Cleanse the injection site with an alcohol swab. Answer. Aspirate for blood return before injecting the medication. Use the Z-track method to prevent medication leakage. Cleanse the injection site with an alcohol swab. This question assesses the nurse's knowledge of proper technique for administering an intramuscular injection. The key phrase intramuscular (IM) injection implies adherence to best practice guidelines for safe administration. Aspirating for blood return confirms the needle is not in a blood vessel. The Z-track method prevents medication from leaking into subcutaneous tissue, and cleansing the site reduces infection risk. A 25-gauge, 5/8" needle is typically too short for an adult IM. Volumes greater than 3 milliliters are usually divided into multiple injections, and the angle for IM is 90 degrees. For example, after inserting the needle, the nurse pulls back on the plunger slightly to ensure no blood appears before pushing the medication. Always use the appropriate needle length, angle, and technique to ensure safe and effective IM medication delivery. Question 17. The nurse is caring for a client with a urinary catheter. Which interventions should the nurse implement to prevent a catheter-associated urinary tract infection, CAUTI? Select all that apply. A. Perform perineal care with soap and water at least daily. B. Ensure the drainage bag is kept below the level of the bladder. C. Clamp the catheter for 30 minutes every 4 hours. D. Irrigate the catheter with sterile saline daily. E. Secure the catheter tubing to the client's thigh. F. Empty the drainage bag only when it is completely full. Answer. Perform perineal care with soap and water at least daily. Ensure the drainage bag is kept below the level of the bladder. Secure the catheter tubing to the client's thigh. This question tests the nurse's understanding of best practices for preventing catheter-associated urinary tract infections. The keyword CAUTI highlights the importance of infection prevention. Performing daily perineal care, keeping the drainage bag below bladder level to prevent backflow, and securing the catheter to prevent urethral trauma are all essential. Clamping or routine irrigation is generally not recommended, and emptying the bag before it's completely full helps prevent overdistension and reflux. For instance, ensuring the catheter tubing is taped to the thigh prevents tugging and irritation at the meatus. Always prioritize meticulous hygiene and proper drainage system management to minimize the risk of CAUTI. Question 18. A nurse is assessing a client for signs of increased intracranial pressure, ICP. Which findings would indicate increasing ICP? Select all that apply. A. Bradycardia. B. Increased systolic blood pressure with widened pulse pressure. C. Pinpoint pupils. D. Decreased level of consciousness. E. Bradypnea or irregular respirations. F. Hyperthermia. Answer. Bradycardia, increased systolic blood pressure with widened pulse pressure, decreased level of consciousness, bradypnea or irregular respirations. This question assesses the nurse's ability to recognize the classic signs of increased intracranial pressure. The key phrase, increased intracranial pressure, ICP, directs the focus to neurological changes. Bradycardia, increased systolic blood pressure with a widened pulse pressure, Cushing's triad, decreased level of consciousness, and bradypnea or irregular respirations are all critical indicators of rising ICP. Pinpoint pupils can indicate pontine damage or opioid overdose, and hyperthermia is a less consistent sign. For example, a client who was previously alert but is now difficult to rouse and has a slow heart rate is likely experiencing increased ICP. Promptly identifying these changes is crucial for timely intervention and preventing irreversible brain damage. Question 19. The nurse is teaching a client newly diagnosed with asthma about managing their condition. Which statements indicate effective teaching? Select all that apply. A. I should use my bronchodilator inhaler as soon as I feel an attack starting. B. I will limit my physical activity to avoid triggering an asthma attack. C. It's important to identify and avoid my asthma triggers. D. I should only use my corticosteroid inhaler when I'm having severe symptoms. E. I will keep a diary of my peak flow meter readings. F. I need to get a flu shot every year. Answer: I should use my bronchodilator inhaler as soon as I feel an attack starting. It's important to identify and avoid my asthma triggers. I will keep a diary of my peak flow meter readings. I need to get a flu shot every year. This question tests the client's understanding of self-management strategies for asthma. The phrase effective teaching indicates correct statements should be selected. Using a bronchodilator for quick relief, identifying and avoiding triggers, monitoring peak flow readings, and getting an annual flu shot are all vital components of asthma management. Limiting physical activity is often unnecessary with controlled asthma, and corticosteroid inhalers are for daily prevention, not just severe symptoms. For example, if a client knows that pet dander triggers their asthma and actively avoids it, this shows good understanding. Empower clients by teaching them how to proactively manage their asthma, recognize worsening symptoms, and prevent exacerbations. Question 20. A nurse is preparing to administer medications to a client who is NPO for surgery. Which actions are appropriate? Select all that apply. A. Withhold all oral medications as ordered. B. Consult with the healthcare provider about essential medications. C. Administer liquid medications with a small sip of water. D. Obtain an order for alternative routes of administration if needed. E. Inform the client why certain medications are being withheld. F. Crush all pills and mix them with applesauce for easier swallowing. Answer: consult with the healthcare provider about essential medications, obtain an order for alternative routes of administration if needed, inform the client why certain medications are being withheld. This question addresses the nurse's role in managing medications for a client who is NPO, nothing by mouth, prior to surgery. The keyword NPO for surgery indicates that medication administration requires careful consideration. The nurse must consult the healthcare provider about essential medications that cannot be safely withheld, obtain orders for alternative routes, like 4, if oral medications are critical, and inform the client of the rationale to promote understanding and adherence. Administering oral medications, even with sips of water, or crushing pills with applesauce violates NPO status. For instance, a client on critical cardiac medication would likely receive it intravenously with a specific provider order. Always prioritize client safety and clear communication with the healthcare team and client when NPO status affects medication administration. Question 21. The nurse is caring for a client with a fractured femur in buccal traction. Which nursing interventions are appropriate? Select all that apply. A. Assess skin integrity under the traction boot every 4 hours. B. Ensure the weights hang freely and are not resting on the floor. C. Remove the weights temporarily to allow the client to ambulate to the bathroom. D. Perform neurovascular checks on the affected extremity every 2 to 4 hours. E. Reposition the client every hour to prevent pressure injuries. F. Provide overhead trapeze bar for client self-repositioning. Answer: assess skin integrity under the traction boot every 4 hours, ensure the weights hang freely and are not resting on the floor, perform neurovascular checks on the affected extremity every 2 to 4 hours, provide overhead trapeze bar for client self-repositioning. This question tests the nurse's understanding of appropriate care for a client in buccal traction. The keywords fractured femur and buccal traction guide the focus on maintaining traction and preventing complications. Assessing skin integrity prevents pressure injuries, ensuring weights hang freely maintains continuous pull, performing neurovascular checks monitors for circulation and nerve damage, and a trapeze bar aids independence. Weights should never be removed temporarily, and repositioning frequency depends on the client's condition, with specific attention to avoiding traction disruption. For example, If the nurse notices the weights are resting against the bed frame, they must immediately adjust them to ensure proper traction. Prioritize maintaining effective traction and diligent monitoring to prevent complications in clients with musculoskeletal injuries. Question 22. A nurse is caring for a client with a peripheral 4 catheter. Which signs indicate phlebitis at the insertion site? Select all that apply. A. Pallor around the site. B. Pain or tenderness at the site. C. Redness along the vein pathway. D. Warmth at the site. E. Edema distal to the site. F. Palpable cord along the vein. Answer. Pain or tenderness at the site, redness along the vein pathway, warmth at the site, palpable cord along the vein. This question assesses the nurse's ability to identify clinical manifestations of phlebitis, a common 4 complication. The keyword phlebitis points to inflammation of the vein. Pain, tenderness, redness along the vein, warmth, and a palpable cord are all classic signs of phlebitis. Pallor and edema distal to the site are more indicative of infiltration or compartment syndrome. For instance, if the client reports localized pain and the nurse observes a red streak extending up the arm from the 4 site, phlebitis is likely. Promptly discontinuing the 4 and applying warmth can help alleviate symptoms and prevent further inflammation. Question 23. The nurse is providing education to a client prescribed levothyroxine for hypothyroidism. Which statements indicate effective teaching? Select all that apply. A. I should take this medication with food to prevent an upset stomach. B. I will take this medication in the morning on an empty stomach. C. It might take several weeks to notice the full effects of this medication. D. I need to have regular blood tests to check my thyroid hormone levels. E. If I forget a dose, I should take 2 pills the next day. F. I should report any chest pain or palpitations to my doctor. Answer. I will take this medication in the morning on an empty stomach. It might take several weeks to notice the full effects of this medication. I need to have regular blood tests to check my thyroid hormone levels. I should report any chest pain or palpitations to my doctor. This question tests the client's understanding of key aspects of levothyroxine therapy for hypothyroidism. The medication levothyroxine and condition hypothyroidism are the clues for specific teaching. Taking the medication on an empty stomach in the morning maximizes absorption, understanding that full effects take weeks manages expectations, regular blood tests monitor therapeutic levels, and reporting chest pain or palpitations is crucial for detecting overdose or cardiac side effects. For example, a client should be taught to take their pill with a glass of water upon waking, at least 30 to 60 minutes before breakfast. Emphasize consistency in medication administration and diligent follow-up for optimal thyroid function. Question 24. A nurse is assessing a client for potential elder abuse. Which findings should raise the nurse's suspicion? Select all that apply. A. Multiple bruises in various stages of healing. B. Client's spouse always answers questions for the client. C. Unexplained weight loss or poor hygiene. D. Client expresses feelings of loneliness or sadness. E. Frequent falls documented in the medical record. F. Delay in seeking medical treatment for injuries. Answer. Multiple bruises in various stages of healing. Client's spouse always answers questions for the client. Unexplained weight loss or poor hygiene. Delay in seeking medical treatment for injuries. This question addresses the nurse's role in recognizing potential signs of elder abuse. The keyword elder abuse directs the nurse to look for red flags that may indicate harm. multiple bruises, a caregiver who overly controls interactions, unexplained weight loss or poor hygiene, and a delay in seeking treatment for injuries are all potential indicators. While feelings of loneliness or frequent falls are concerns, they are less specific indicators of abuse than the other options. For instance, if a frail client has a burn injury that is days old and the caregiver gives a vague explanation, the nurse should be suspicious. Always trust your instincts and thoroughly investigate any signs that suggest an elder may be at risk. Question 25. The nurse is preparing a sterile field for a dressing change. Which actions maintain sterility? Select all that apply. A. Place sterile items on the very edge of the sterile field. B. Open sterile packages away from the body. C. Hold sterile objects below waist level. D. Keep the sterile field within the line of sight. E. Avoid talking, coughing, or sneezing over the sterile field. F. Consider the outer 1-inch border of the sterile field as contaminated. Answer. Open sterile packages away from the body, keep the sterile field within the line of sight, avoid talking, coughing, or sneezing over the sterile field, consider the outer 1-inch border of the sterile field as contaminated. This question tests the nurse's adherence to aseptic technique when preparing a sterile field. The phrase, maintain sterility, is the key to selecting correct actions. Opening packages away from the body prevents contamination, keeping the field in sight ensures awareness of any breaks, avoiding talking prevents airborne microorganisms from settling, and considering the 1-inch border contaminated acts as a safety zone. Sterile items should be placed well within the field, not on the edges, and sterile objects must remain above waist level to be considered sterile. For example, the nurse tears open a sterile glove package, peeling the wrapper back and away from their body to avoid contaminating the gloves. Mastering sterile technique is fundamental to preventing infections in client care. Question 26. A client is experiencing an acute asthma exacerbation. Which assessment findings require immediate nursing intervention? Select all that apply. A. Peak expiratory flow rate, PEFR. 80% of personal best. B. Wheezing heard throughout all lung fields. C. Use of accessory muscles to breathe. D. Oxygen saturation of 90% on room air. E. Client reports feeling anxious. F. Cyanosis around the lips and nail beds. Answer. Use of accessory muscles to breathe, oxygen saturation of 90% on room air, cyanosis around the lips and nail beds. This question focuses on identifying critical signs of worsening respiratory distress during an asthma exacerbation, requiring immediate intervention. The keywords acute asthma exacerbation and immediate nursing intervention highlight severe symptoms. Use of accessory muscles, oxygen saturation of 90% or less, and cyanosis are all signs of significant respiratory compromise and impending respiratory failure. While wheezing is common and anxiety understandable, a PEFR of 80% is still within the yellow zone and less critical than the other findings. For instance, if a client's lips start turning blue, the nurse must immediately escalate care and prepare for advanced respiratory support. Always prioritize signs that indicate inadequate oxygenation and ventilation in respiratory emergencies. Question 27. The nurse is caring for a client scheduled for a barium enema. Which instructions should the nurse provide? Select all that apply. A. You will need to be NPO for 8 hours before the procedure. B. Drink plenty of clear liquids the day before the exam. C. Expect bright red stools after the procedure. D. You may experience some abdominal cramping during the procedure. E. Take a laxative or bowel preparation as prescribed before the exam. If. Increase your fiber intake for several days before the exam. Answer. You will need to be NPO for 8 hours before the procedure. Drink plenty of clear liquids the day before the exam. You may experience some abdominal cramping during the procedure. Take a laxative or bowel preparation as prescribed before the exam. This question tests the nurse's knowledge of client preparation and expectations for a barium enema. The phrase barium enema is the key to understanding the specific preparation needed. Being NPO, drinking clear liquids, and taking prescribed laxatives are all crucial for bowel preparation, ensuring a clear view. Clients should also be informed that abdominal cramping is common during the procedure. Expecting bright red stools is incorrect. Stools will likely be white or clay-colored after barium, and increasing fiber intake before the procedure is contraindicated. For example, the nurse might instruct the client to only consume broth and clear juices the day before the exam. Proper bowel preparation is essential for a successful and accurate barium enema. Question 28. A nurse is caring for a client in the immediate postoperative period following a surgical procedure. Which actions are appropriate? Select all that apply. A. Assess airway, breathing, and circulation, ABCs, frequently. B. Administer pain medication only after the client rates pain 7/10. C. Monitor vital signs every 15 minutes until stable. D. Position the client to prevent aspiration. E. Encourage deep breathing and coughing exercises. F. Remove the surgical dressing after 4 hours to assess the incision. Answer. Assess airway, breathing, and circulation, ABCs, frequently. Monitor vital signs every 15 minutes until stable. Position the client to prevent aspiration. Encourage deep breathing and coughing exercises. This question assesses the nurse's immediate priorities in the postoperative period. The phrase immediate postoperative period signifies a critical time for monitoring and preventing complications. Frequent assessment of ABCs, vital signs monitoring every 15 minutes until stable, positioning to prevent aspiration, and encouraging deep breathing and coughing are all crucial for recovery. Pain medication should be administered proactively, and surgical dressings are typically not removed for at least 24 to 48 hours unless there's an issue. For instance, the nurse might place an unconscious client in a lateral position to maintain an open airway and prevent aspiration of vomit. Always prioritize ABCs and continuous monitoring to ensure a safe and stable postoperative recovery. Question 29. The nurse is teaching a client with peripheral artery disease, P80, about strategies to improve circulation and reduce symptoms. Which instructions should the nurse include? Select all that apply. A. Elevate your legs above heart level when resting. B. Stop smoking or using any tobacco products. C. Wear well-fitting, comfortable shoes. D. Perform regular, supervised exercise, such as walking. E. Apply heating pads to your legs for comfort. F. Inspect your feet daily for any sores or injuries. Answer. Stop smoking or using any tobacco products, wear well-fitting, comfortable shoes, perform regular, supervised exercise, such as walking, inspect your feet daily for any sores or injuries. This question tests the nurse's knowledge of non-pharmacological interventions for managing peripheral artery disease. The diagnosis, peripheral artery disease, P80, is the key, indicating issues with arterial blood flow to the extremities. Stopping smoking is crucial to halt disease progression. Wearing comfortable shoes protects the feet. Regular exercise can improve collateral circulation, and daily foot inspection helps detect injuries early. Elevating legs above heart level can actually worsen arterial blood flow, and applying heat can damage compromised tissue. For example, a client with PAD should be encouraged to walk to the point of discomfort, rest, and then continue walking. Emphasize that lifestyle modifications are paramount in managing PAD and preventing complications. Question 30. A nurse is providing care for a client receiving chemotherapy who develops neutropenia. Which precautions should the nurse implement? Select all that apply. A. Place the client in a private room. B. Ensure all visitors wear a surgical mask. C. Avoid fresh fruits and vegetables in the diet. D. Monitor temperature frequently for signs of infection. E. Administer granulocyte colony stimulating factors, GCSFs, as ordered. F. Encourage staff to wear an N95 respirator when entering the room. Answer. Place the client in a private room, avoid fresh fruits and vegetables in the diet, monitor temperature frequently for signs of infection, administer granulocyte colony stimulating factors, GCSFs, as ordered. This question focuses on protective measures for a client with chemotherapy-induced neutropenia. The keywords chemotherapy and neutropenia indicate a compromised immune system and high risk for infection. Placing the client in a private room reduces exposure to pathogens, avoiding fresh fruits and vegetables prevents ingestion of bacteria, frequent temperature monitoring detects early infection, and administering GCSFs helps stimulate white blood cell production. Surgical masks for visitors are not always required unless they are symptomatic, and N95 respirators are for airborne precautions, not neutropenic precautions. For instance, the nurse would ensure the client's meal tray contains only cooked foods and peeled fruits. Always prioritize strict infection control to protect neutropenic clients from serious infections. Question 31. The nurse is assessing a client with a suspected ruptured ectopic pregnancy. Which assessment findings are consistent with this condition? Select all that apply. A. Severe, sharp, unilateral abdominal pain. B. Vaginal bleeding, often dark red or brown. C. Referred shoulder pain. D. Absence of amenorrhea. E. Signs of hypovolemic shock. F. Uterine enlargement disproportionate to gestational age. Answer. Severe, sharp, unilateral abdominal pain, vaginal bleeding, often dark red or brown, referred shoulder pain, signs of hypovolemic shock. This question assesses the nurse's ability to recognize the critical signs and symptoms of a ruptured ectopic pregnancy. The phrase ruptured ectopic pregnancy is the key, indicating a medical emergency. Severe unilateral abdominal pain, vaginal bleeding, often dark, referred shoulder pain, due to diaphragmatic irritation from internal bleeding, and signs of hypovolemic shock, e.g., hypotension, tachycardia, are all classic indicators. Amenorrhea, absence of menstruation, is typically present, not absent, and uterine enlargement is not disproportionate. Instead, it would be normal or slightly enlarged, unlike with a viable intrauterine pregnancy. For example, a pregnant client presenting with sudden, excruciating lower abdominal pain and feeling faint should raise immediate suspicion. Rapid identification and intervention are crucial to prevent life-threatening maternal hemorrhage. Question 32. A nurse is educating a client about self-administration of insulin. Which instructions should the nurse include? Select all that apply. A. Rotate injection sites to prevent lipohypertrophy. B. Store opened insulin vials in the refrigerator. C. Always aspirate before injecting to ensure you're not in a blood vessel. D. Inject insulin into the same site daily for consistent absorption. E. Dispose of used needles in a puncture-proof container. F. Shake cloudy insulin vigorously before drawing it up. Answer. Rotate injection sites to prevent lipohypertrophy, dispose of used needles in a puncture-proof container, shake cloudy insulin vigorously before drawing it up. This question focuses on essential teaching points for safe insulin self-administration. The concept is self-administration of insulin. Rotating injection sites prevents lipohypertrophy, fat deposits, proper needle disposal prevents needle stick injuries, and gently rolling, not shaking vigorously, cloudy insulin mixes it evenly. Open insulin vials should be stored at room temperature, not refrigerated, and aspiration is generally not recommended for subcutaneous insulin injections. Injecting into the same site daily is incorrect. Rotation is key for consistent absorption and tissue health. For example, the nurse should demonstrate how to select different areas of the abdomen, thighs, or upper arms for daily injections. Emphasize that correct technique and disposal are crucial for effective and safe insulin therapy. Question 33. The nurse is caring for a client with a chest tube after a thoracotomy. Which findings require immediate intervention? Select all that apply. A. Continuous bubbling in the water seal chamber. B. Drainage of 50 milliliters of serosanguineous fluid in the past hour. C. Tracheal deviation to the unaffected side. D. Disconnection of the chest tube from the drainage system. E. Subcutaneous emphysema around the insertion site. F. Titling in the water seal chamber. Answer. Continuous bubbling in the water seal chamber, tracheal deviation to the unaffected side, disconnection of the chest tube from the drainage system, subcutaneous emphysema around the insertion site. This question assesses the nurse's ability to identify critical complications related to a chest tube, requiring immediate intervention. The keywords chest tube and immediate intervention signal the need to prioritize life-threatening findings. Continuous bubbling in the water seal chamber often indicates an air leak, tracheal deviation suggests a tension pneumothorax, disconnection means loss of negative pressure, and subcutaneous emphysema indicates air leakage into tissues. Titling is normal and expected, and 50 milliliters of drainage in an hour is usually acceptable post-thoracotomy. For instance, if the chest tube disconnects, the nurse must immediately clamp the tube and immerse the end in sterile water. Always prioritize patient safety by rapidly addressing chest tube complications. Question 34. A nurse is providing education to a client with new onset hypertension about lifestyle modifications. Which recommendations should the nurse include? Select all that apply. A. Limit intake of foods high in potassium. B. Reduce sodium intake. C. Engage in regular aerobic exercise for at least 30 minutes most days. D. Maintain a healthy weight. E. Consume moderate amounts of alcohol, such as 1 drink per day for women. F. Increase intake of foods rich in saturated and trans fats. Answer. Reduce sodium intake, engage in regular aerobic exercise for at least 30 minutes most days, maintain a healthy weight, consume moderate amounts of alcohol, such as 1 drink per day for women. This question focuses on essential lifestyle modifications for managing hypertension. The phrase new onset hypertension and lifestyle modifications are the key clues. Reducing sodium intake, engaging in regular aerobic exercise, maintaining a healthy weight, and consuming alcohol in moderation are all proven strategies to lower blood pressure. Limiting potassium is generally incorrect unless medically indicated, and increasing unhealthy fats is detrimental to cardiovascular health. For example, replacing salty processed snacks with fresh vegetables is a simple way to reduce sodium. Emphasize that consistent adherence to these lifestyle changes is a cornerstone of effective hypertension management. Question 35. The nurse is assessing a client admitted with a severe allergic reaction, anaphylaxis. Which assessment findings should the nurse expect? Select all that apply. A. Generalized urticaria and pruritus. B. Hypotension. C. Bradycardia. D. Bronchospasm and stridor. E. Angioedema. F. Hypertension. Answer. Generalized urticaria and pruritus, hypotension, bronchospasm and stridor, angioedema. This question tests the nurse's ability to identify the classic signs and symptoms of a severe allergic reaction. The term anaphylaxis is the crucial keyword, indicating a systemic, life-threatening response. Generalized urticaria, hives, pruritus, itching, hypotension, bronchospasm, stridor, and angioedema, swelling, especially of the face/airway, are all characteristic manifestations. Bradycardia and hypertension are typically not associated with anaphylactic shock. Tachycardia and hypotension are more common. For instance, if a client reports sudden difficulty breathing, develops hives all over their body, and their blood pressure drops, the nurse should immediately suspect anaphylaxis. Prompt recognition and administration of epinephrine are critical to reversing anaphylaxis and saving a life.